This is an overview of what I plan to talk about today. I'm going to start with an overview of perfectionism, and then we'll talk about some models of perfectionism, causes of perfectionism, related problems. We'll talk about assessment of perfectionism. There'll be an introduction to cognitive behavioral treatments of perfectionism. We'll talk a little bit about research on cognitive behavioral treatments. And then we'll talk about specific cognitive behavioral strategies, cognitive strategies, behavioral strategies, mindfulness and acceptance-based strategies. I've also got some material on dealing with perfectionism in your life, and this could be clients or patients who are perfectionistic, or family members, well, I guess dealing with perfectionism in yourself as well. A lot of the day-to-day will be relevant. My experience with these seminars is that people are often here for lots of different reasons. So sometimes people are here for learning ways of treating a particular problem. Sometimes it's a way of just learning to understand a problem so that when you see it in your clients and patients, you've got a better understanding of it. For other people, people are here for more personal reasons, either for themselves or for family members who may be struggling with a particular problem. We'll talk about challenges in treatment and strategies for dealing with ambivalence in treatment, motivational interviewing, for example. Again, depending on how our time goes today, and a little bit on administering treatment in groups if you do any group therapy. So, another sort of point that I want to make here is that perfectionism is a transdiagnostic construct. In other words, it's something that occurs across a large number of problems and may even be a driving force in terms of contributing to these problems. So I've seen cases, for example, where people are depressed. They're also very anxious in social situations. They have some binging and purging, kind of eating disorders behaviors. And they also maybe have some trouble in their relationships, some communication issues. And when you get talking to people, some people, it seems that perfectionism is really sort of at the core of all of these different problems. And if you could teach the person to have more flexible standards across a wide range of situations, then you would see all of these problems kind of disappear. So in some cases, it may be important not just to think about diagnostic kind of categories, but very much to focus on transdiagnostic constructs like perfectionism that may really be having an impact across problems. So these are problems that have been found to be associated with perfectionism. So as I mentioned, social and performance anxiety. Someone who has a lot of public speaking fear may have the belief that they have to give a perfect presentation every time. Worry and generalized anxiety disorder. This is a problem where people worry too much. They worry about everything. They worry about their health. They worry about their family's safety. They worry about the quality of their work. And you can see how perfectionism might creep into that. Obsessive-compulsive disorder and obsessive-compulsive personality disorder, which we've spoken about. Eating disorders, and here perfectionism is very much focused on body image and weight and eating behaviors, although again it can creep into other domains as well. Body dysmorphic disorder, this is a problem where people are convinced that they're physically unattractive in some way. They have some sort of physical defect. It may be that their nose is too big, that their arms are not symmetrical, that their complexion is bad, there's something wrong with their hair. And they engage in all kinds of behaviors to try to correct or hide the defect. And in body dysmorphic disorder, what makes this a problem is that there is no physical defect. Or if there is, it's so mild that most people wouldn't notice it or wouldn't care about it. And so this is another problem where we see a lot of perfectionistic kinds of beliefs, typically focused on physical appearance. It's been found to be elevated in people with chronic fatigue syndrome. And it's hard to know whether it's the chronic fatigue or some of the associated factors. So we know the chronic fatigue is also associated often with worry and low mood and so on. Problem anger, especially perfectionism aimed at other people, may be associated with anger when people don't meet your standards. Depression, suicidal ideation as well is associated with perfectionism. With perfectionism, but not about perfectionism itself, I guess, as a trait in terms of age and gender. So, and it probably looks different. I imagine that it might look different in men and women in terms of the types of domains that are affected. But again, I haven't seen data specifically on that. It's still I would still describe perfectionism in terms of research as an emerging area. So what you may find that a lot of the questions today that I can answer them in the context of some of the problems that are associated with perfectionism, because we know a lot more about depression than we do about perfectionism as a trait. But we won't, a lot of these things we may not know about perfectionism specifically. Okay. I want to share with you some descriptive models of perfectionism. And the first one is Hewitt and Flett's multidimensional model. So this was Hewitt and Flett are both from Canada. And they describe perfectionism as being associated with three different dimensions. Self-oriented perfectionism, which is perfectionism focused on the self, so having to meet high standards oneself. Other-oriented perfectionism, which is the belief that other people need to meet my standards. So again, it's focused on, my spouse needs to talk properly, for example, or needs to keep the house clean. Other people at work need to do a good job. And socially prescribed perfectionism. This is a perfectionism that the person believes that others have for them. So other people expect me to be perfect. And it turns out that some of these are more or less associated with psychopathology than others. So problems like depression and social anxiety. Any guesses which of these is most associated with psychopathology? Self-oriented? No? Any other guesses? Socially prescribed? Yeah, I would have guessed self-oriented, but I would have been wrong. So self-oriented perfectionism has not been found to be all that closely related to problems with depression and anxiety. What seems to be most related is socially prescribed perfectionism. The more somebody feels like other people expect me to be perfect, the more likely they are to experience depression, anxiety, and all these other sorts of problems. Same with other-oriented perfectionism. It may make other people miserable if somebody tends to be very perfectionistic toward others, but it doesn't seem to be related to one's own depression or anxiety. I should mention for self-oriented perfectionism, one exception is in eating disorders. So in eating disorders, unlike in depression or anxiety, in eating disorders we do see high levels of self-oriented perfectionism in addition to socially prescribed perfectionism. The other model I want to mention is Randy Frost's model. Frost and colleagues. So they described 6 different dimensions of perfectionism. So concern over making mistakes. So worry about not doing things perfectly. Doubts about one's actions. So, for example, a belief that you haven't done things well, and you may have to go back and correct them or check them. And we've done some research. In fact, this is what got me, a lot of my work is in the area of anxiety disorders, and what got me interested in perfectionism was a study that we did looking at perfectionism across anxiety disorders. And we found that people with a lot of social anxiety tended to have a lot of concern over making mistakes. We saw in obsessive-compulsive disorder concern over making mistakes as well, but we also saw a lot of doubts about actions, which may help to explain why people with OCD have to go back and check and recheck over and over again. They might even doubt whether their checking was perfect enough and might have to go back to check. Personal standards. This is just a tendency to have high standards. So wanting to do a good job, essentially. The next two are not really components of perfectionism, but they might help to explain perfectionism. The first is parental expectations, a tendency to believe that your parents had very high expectations of you. And the second there is parental criticism. And this is the tendency to believe that your parents were very critical of you. And just if we look at and the last one is organization. This is a tendency to be very detail-oriented, kind of have a lot of rules and those kinds of things. The kinds of things we see in obsessive-compulsive personality disorder. Anyone my age or older will remember Felix Unger on The Odd Couple. He had a lot of this sort of obsessive-compulsive personality kind of style. Or I didn't really watch Fraser, but I understand his brother Niles also had some of that as well. I'm sure there are newer popular culture references than Fraser and The Odd Couple, but I don't know them. So, Big Bang Theory? Okay. So there's somebody on the Big Bang Theory that's like that as well. Who is that? Sheldon. Oh, somebody has told me about Sheldon before. Yes. I have to watch that. In terms of the relationship between these different dimensions in psychopathology, I mentioned that the first two are associated with OCD and social anxiety. Personal standards is not really associated with problems. So it's perfectly fine to have high personal standards and want to do a good job in your work and take pride in your work. That's not associated with, in fact, if anything, it's negatively correlated. So the higher people's personal standards on that scale, I'll share with you information about a measure for measuring these different dimensions, the less depressed people are often. These two, parental expectations and parental criticism, do tend to be associated with problems. These are kind of like socially prescribed perfectionism in the Hewitt and Flett model, right? It's kind of the idea that other people expect me to be perfect. And interestingly, organization is not correlated with any of these. So it seems to be something very different. It kind of comes back to what I mentioned earlier, that the obsessive-compulsive personality kind of perfectionism is different than that tendency that we see in anxiety and depression and eating disorders to have these sort of high standards that if you don't meet, you kind of feel devastated or you feel like you failed. That kind of focus on detail is something different. So if we think about Sheldon and the Big Bang Theory, is he depressed? No. See, he's fine with it. He's very, so he's very focused on detail, but he's okay with it. Whereas, again, people with some of these other types of perfectionism, it tends to cause problems with depression, anxiety, and so on. Okay. So, increasingly, people are really studying or thinking about perfectionism as something that can be a positive. Again, being like Martha Stewart, having high standards can make you very successful. Assuming that the people around you can tolerate those high standards that you have. But there can also be negative perfectionism. And there's a long history. I'm sure it goes back thousands of years, people talking about perfectionism. But more recently, there's a history over the last century of a number of therapists sort of writing about perfectionism. So Horney talked about the tyranny of the shoulds. Albert Ellis talked about masturbation. He also talked about shoulding on yourself. And then Hamachek talked about normal versus neurotic perfectionism. More recently, people have tried to, not from a clinical perspective, but more from a psychometric perspective, using research to actually try to see whether you can get clusters of normal, kind of helpful perfectionism versus pathological perfectionism. And people have talked about adaptive perfectionism, healthy perfectionism, normal perfectionism versus maladaptive, neurotic, clinical perfectionism, unhealthy perfectionism. And there have been a number of different scales that have confirmed that there seems to be, a number of different studies, there seems to be sort of a helpful cluster of perfectionistic behaviors and a less helpful cluster. And I mentioned earlier that some of the scales, some of the subscales from the Hewitt and Flett and the Frost model that are associated with helpful perfectionism versus unhelpful. And this just sort of lays that out on a slide for you. So I'm going to talk next about causes of perfectionism. And before I do that, I'm wondering if there are any questions so far. No? Yes?
You talk about it directed toward self and directed toward others. But it seems to me that, especially with some of the autism spectrum, that it's directed at the environment.
Mm-hmm.
A lot of Sheldon stuff is about just where he sits and where things are put. It's not a personal thing at all.
Yeah. No, that's a good point. So the Hewitt and Flett's model talks about self-oriented versus other-oriented perfectionism, and in Sheldon, in the Big Bang Theory, which I've never seen, the perfectionism is aimed more at the environment, that things need to be perfectly placed. And you mentioned the sort of autism spectrum, where people may have rules about what order the books are in on the shelf, those kinds of things. That's the kind of perfectionism we also see a lot in obsessive-compulsive personality disorder. So some of it may be aimed at, I have to do things a certain way and my spouse has to do things a certain way. A lot of it is just aimed at the environment. Things need to be lined up in a certain way. The chairs need to be in a certain place. And that kind of perfectionism, again, Hewitt and Flett, these models of perfectionism don't really address that obsessive-compulsive personality kind of perfectionism. It's almost like they're ignoring that. And they're talking more about those high standards that I can't possibly meet and I feel devastated because I can't meet them, that kind of perfectionism. So again, throughout the day today, I'm going to try to talk about both, but we may want to think of them as somewhat a little different. So the self-oriented and other-oriented, that model really, it doesn't speak to what you're saying. I think that's an important observation, though. Yeah.
I know there's a continuum, but could you describe a little bit more to get a feel of between maladaptive versus the positive achievement? I'm not quite sure what are sort of the landmarks of that.
Yeah, the question was, can I talk more about maladaptive perfectionism versus perfectionism involving sort of positive achievement kind of perfectionism. So the kinds of things clinically, so if we sort of just talk very practically about what you might want to look for there, the sort of positive perfectionism would be a tendency to have high standards and to want to do a good job and to work hard to do a good job. And likely the person would also achieve high standards or achieve their high standard in that situation. So the standard is reachable, typically with sort of the positive kind of perfectionism. So people are not setting their goals so high that they can't possibly reach them. I think that's one difference. And second, with maladaptive perfectionism, there are consequences of the perfectionism. So for example, as a result of the perfectionism, they may procrastinate because they're worried that they can't possibly meet their high standards. The standard, again, may be completely unreachable. And again, if they're defining their self-worth in terms of whether they meet this unreachable standard, they're going to constantly come up short. And as a result of that, they're going to feel that they don't have self-worth, which may, again, trigger depression. They may be very anxious in situations or avoid certain situations for fear of not being able to meet the standards. So what I would look for maladaptive perfectionism is the perfectionism helping the person, or is it getting in the way of their performance in the situation? I think that would be an important question to ask. Mm-hmm.
Have you noticed any traits of people-pleasing in any of those? Would that be more along the socially prescribed perfectionism? Have you noticed?
Yeah, the question was about people-pleasing and whether the tendency to be a people-pleaser could be associated with perfectionism. And it absolutely can be. So if people set a high standard for how they need to come across to other people, that they need to get approval from other people. Now, not everyone who's high in perfectionism is driven by pleasing other people, but some people, a lot of people certainly are. So in those cases, yeah, they may do all kinds of things to make sure that they've pleased other people. They may ask for reassurance constantly that they're doing a good job. They may put in way too much time at the detriment of their own. So, for example, if a boss asks the person whether they can stay a little bit late, the person might say yes, even if they had some other plan, and not even mention that other plan to the boss. Whereas somebody who's less concerned might just say that, today's not great because I have these dinner plans. Could I stay late tomorrow or something like that? Somebody who's, where it's really, really important to always make a perfect impression might just cancel everything else, even if it's not that important to cancel everything in that situation. Okay. I'd like to talk about causes of perfectionism and related problems. So some of these examples will really be most relevant to some of the anxiety problems associated with perfectionism as well. So there are a few different pathways to developing perfectionism. So interpersonal factors or events have been found to contribute to perfectionism, or at least to be correlated with perfectionism. There may be personality factors that contribute to perfectionism. I'll talk about the role of learning and our experiences. I'll talk about the role of thinking, cognitive factors in perfectionism, and then finally the role of biology. So first, in terms of interpersonal factors, we know that people with maladaptive perfectionism report having perfectionistic parents and also very critical parents, whereas adaptive perfectionists report having perfectionistic parents, but not critical parents. So this suggests that one key, at least, again, this is correlational. We don't know for sure that this causes it. But one factor may be not so much having role models who are somewhat perfectionistic, but rather having role models who are very critical. So you feel like you're not measuring up to other people's expectations. It was also found that adaptive perfectionists report having more balanced, cohesive, and adaptable families and nurturing parents relative to maladaptive perfectionists, and also relative to non-perfectionists. So having very, again, nurturing, adaptable, flexible parents may actually help people to set high standards that they can meet and actually perform well, potentially. So this sort of adaptive perfectionism. The other thing that I want to mention, any studies on perfectionism in families, it's always from the perfectionist's perspective. Almost none of these studies actually interview family members. So usually, there's some exceptions, but usually we don't know whether family members are really perfectionistic or really critical, or whether that's the individual's perspective. And that's really important. You can imagine that somebody who is very perfectionistic might perceive that his parents were very critical, even though they weren't. That may be part of the perfectionism, the maladaptive perfectionism that's driving that.
What about sibling rivalry, where one child is critically emasculated and the other is enhanced, edified, and deified?
Yeah, the question was about sibling rivalry, where one child is sort of put on a pedestal by the parents, and the other child is constantly criticized. I haven't seen studies specifically on that, but I can imagine that wouldn't help. I'll talk about something that's sort of similar to that in just a second, that sort of speaks to that issue. And the other thing is, a lot of the studies have been on behaviors of parents, but there's no reason to think that behaviors of other people wouldn't be relevant as well, right? So if you've got siblings that are very critical of a child, then that can potentially contribute to it as well. Uh-huh. I'm going to come to bullying, yeah. So there is some research on bullying and perfectionism. This is a study that was done with, it's kind of a strange study. Oh, no, this isn't the strange study. That's coming up later. So this study, this is athletes' perceptions of their parents' perfectionism was more predictive of perfectionism among athletes than was the parents' actual level of perfectionism. So this was a study that actually did go ahead and interview the parents as well to get a sense of how perfectionistic they were. And just to support what we were saying earlier, it's actually in this study the perception of the parents' perfectionism that seemed to be most related to perfectionism in the athletes, just relative to the actual perfectionism. The question came up a moment ago about bullying and the contributions to perfectionism. And this is an interesting study that looked at bullying and perfectionism, peer victimization. And again, this was retrospective, so people were kind of recalling bullying experiences when they were younger. And what they found was that recalled history of indirect peer aggression. So examples are being excluded from the group, for example, gossiping, rumor spreading, in childhood was more predictive of perfectionism in adults than a history of direct aggression, so physical aggression, verbal aggression, so where people are actually being threatened. And it's not to say that verbal aggression and physical aggression are good. They probably contribute to we know that they contribute to all sorts of other problems. But in terms of perfectionism, it's negative perfectionism in particular. It's that indirect kind of aggression that seems to be most powerful. In terms of personality traits that are associated with perfectionism, so this was some research done in adolescents. The trait of conscientiousness tended to predict longitudinal increases of self-oriented perfectionism 5 to 8 months later. So if you look at people and you measure a number of different personality traits, conscientiousness is one that if you then look at them about 8 months later, if they're high in conscientiousness, they're more likely to be even higher in self-oriented perfectionism in 8 months than they were at that time. So someone who's very conscientious is basically on a road to having increased self-oriented perfectionism. That's not necessarily a bad thing. Remember that self-oriented perfectionism generally is associated with good performance. It's not necessarily a problem. So conscientiousness may be a good trait, potentially. They also found that the trait of neuroticism, which is a tendency to be distressed. So neuroticism is associated with anxiety, depression, irritability, those kinds of emotions. It tends to be associated with socially prescribed perfectionism. So again, suggesting that that's more of a negative type of perfectionism, this belief that other people expect you to be perfect. Although it doesn't predict long-term increases, but at least at the time that it's measured, it is associated with socially prescribed perfectionism. So there's a little bit of research on personality traits and how they relate to perfectionism. I want to talk about learning now and perfectionism. And the first learning sort of factor that I want to talk about is reinforcement. Reinforcement basically involves being rewarded by the environment, by people in the environment, for behaving in a particular way. So an example with perfectionism is that if you do a really good job on something, you may get rewarded with a bonus or a financial reward of some kind, a raise. You may get praise from other people saying, wow, you did an amazing job on that. And we all know when you get that kind of reinforcement, it feels good, and it makes you want to get that reinforcement again. So you may behave in a way to get that reinforcement again. This is a child in a classroom who's saying, I'm behaving well. Are you sure you don't want to positively reinforce it? And there are other ways that people learn behavior as well. And some of these may be more negative experiences. So some sort of direct traumatic conditioning, for example, or direct traumatic experience. So for example, being severely teased in childhood and developing a lot of social anxiety. So starting to avoid being around people because you don't want to be teased again. Observational learning by watching others be anxious or nervous or perfectionistic. So for example, if you've grown up in a house where your parents are constantly cleaning everything, you may learn that kind of behavior from your parents, and then your own home, everything may need to be perfect. I've also seen the opposite happen, where people grow up in the home of a hoarder, where the place is a mess, and they make the decision, my house is never going to be like that. So I'm going to have a really clean house all the time. So they develop all kinds of obsessive-compulsive cleaning kinds of behaviors. So learning can happen in different kinds of ways. This is an example of how learning can contribute to fear, observational learning. This is a study that was done with monkeys by Meinecke and Cook and colleagues quite a while ago. And what they found was that what they did is they had baby monkeys watch adult monkeys on video, behaving either non-fearfully or fearfully in the presence of a snake. And then later they tested the baby monkeys to see how afraid they were of snakes. And what they found was that baby monkeys who watched the adult monkeys behaving non-fearfully did not really develop a fear of snakes, whereas baby monkeys who watched the adult monkeys behaving fearfully themselves did develop a fear of snakes later on. So just watching someone else be afraid or nervous or probably perfectionistic can potentially trigger those kinds of behaviors. This is a monkey behaving fearfully in that particular clip. Okay. And then the third pathway that I wanted to mention here is informational or instructional learning, which is very powerful. This is learning through language, learning through things that people say, things that you read, things that you see on television. This is how parents might contribute to that. It says here, so she switched deodorants and lived happily ever after. I'm going to come back to this issue in a second, but the deodorant, not just the deodorant industry, but the personal hygiene industry definitely seems to have contributed to people's sort of perfectionistic behaviors and beliefs around hygiene. I was asked earlier about sibling rivalry. This is a comment from a parent that might contribute to that. And this is our spare son in case the first one doesn't live up to our expectations. Okay. So I was talking about the personal hygiene industry. These next few slides are ads. They're old ads, but they're ads for products, a lot of them that we're familiar with, that very much could contribute to this sort of belief that people have that they have to be perfect in situations. So this is an old Listerine ad. It says, halitosis makes you unpopular. It also says it's inexcusable and can be instantly remedied. So, the idea here is, first of all, you absolutely need to use Listerine or you're going to have no friends for the rest of your life. You're never going to have a partner. You're not going to get married. Things are going to be terrible. And second, it's immoral not to use Listerine. It's inexcusable. So that's one product. This is another one, Lifebuoy soap, which some of us remember. It says, once I made the mistake of using ordinary soap to protect against BO. No ordinary soap stops BO like Lifebuoy does. It was actually a soap company, and it wasn't Lifebuoy. It was another one that I've never heard of. I don't think it exists anymore. That created the term BO. that we all take for granted now. And I think it was in the 1920s that the term was created. It's kind of like lately the TV commercials talking about ED, erectile dysfunction. Okay. This is another one. Remarkable development in the fight against teenage acne, the scourge that shames and disfigures so many of our young people. So all of these sort of feed perfectionism potentially around personal hygiene, around personal appearance. And there's lots of examples of this in the media. And then products. Lately, one of the things that people seem to be very kind of perfectionistic about is cleanliness and germs. This was not a big deal when I was little. People didn't talk about it as much. I mean, we knew that germs cause diseases and things. It's not like people didn't know about that. But they didn't, people weren't wearing gloves in bakeries and hairnets and all these other things that they do now. This is a product that's become very, very popular over the years that, I've surveyed audiences in the past, and about a third of people carry around Purell in their bag, and probably all of us have used Purell at one point or another. I always ask people when I survey them,